Now, it is Men's Mental Health Month, the time to raise awareness and have important conversations about the struggles that we all face. Unfortunately, there's often a stigma around men talking about their mental health because, you know, we're supposed to be this tough person. We don't let it out. So Dr. Ruskin joins us to talk about how we can get the men in our lives to talk about it. Good morning.
Yes, good morning. I'm so glad we're talking about this.
It is important, right? Because we kind of have this thing where, you know, people, our women want us to talk about it, but we can't.
That, you just nailed it. That's the double bind effect, where on the one hand it's men, talk about your feelings, and then it's check your privilege, don't talk about your feelings, don't express. And if you think about it, from a very young age, a boy falls down, get up, wipe it off, you're fine.
Yeah.
So males specifically have learned that there is a social stigma, that it is a weakness, that it is a vulnerability, and so they are less likely to go for help, more likely to downplay their symptoms, and in fact, men are more likely to be misdiagnosed for those who do get help because they tend to express themselves outwardly when feeling inward pain, like via aggressive behaviors or through distraction methods like alcohol or substance abuse, which is why men are more likely. It's actually, there's some statistic about that. It's 1 in 5 men are likely to be diagnosed with alcohol dependency, and 4 times more likely than women to commit suicide.
Really?
These are serious results.
That's very sad to hear that.
Yeah.
So if you're a man sitting at home, what do you need to do?
Okay.
And symptoms you need to look for.
Thank you. So if you're a man sitting at home, please know, not only is it not a weakness, it's not a weakness to look out for your mental health and wellness. It's actually a strength. It's courageous, because if you help yourself, that means you're going to be helping all those around you. If you have kids, if you have a wife, if you have a friend, you're going to affect those around you. It's a systems-wide approach. And men who speak out and advocate for their health and wellness and get help will help other males. And if men start to teach their boys at a young age, any coaches, any teachers, this is a system-wide effect. Doctors being able to talk to their patients, because often a low testosterone will be correlated with irritability symptoms. Now, if you are a woman who loves your man, whether it's your son, whether it's your uncle, whether it's your spouse, your mate, your friend, your grandfather, all the males around us, being able to tell them you care, and you do want to hear their feelings, and show that with your actions. So whether you're a man to go for help, and by the way, help is physical and mental. There's a big mind-body connection, and often, although men might exercise physically with stamina and strength, really also breath work. I know, it sounds so, oh really, breath work's non-masculine?
No, I've heard such great things about breath work.
This is a real thing. Athletes, military, if you utilize breath, you can actually calm your nervous system and be able to think more clearly. So, men at home, get help. Don't be afraid to. There's so many resources out there. People who want to help, and women who love their man, talk to their man at a young age as a boy, their man is an adult. Let them know you care, and if you see a problem, address it. So, key thing for men, you ready for this?
Ready.
Drum roll, please.
All right.
Express and address. Do not suppress.
I like it. All right, Dr. Karen, we're out of time. This obviously is an important subject we could talk a lot more about, but I think you hit it right on the nail.
Thank you.
Thank you so much.